When you hear the word hypnosis, what's the first thing that pops into your head? A swinging pocket watch, maybe? Someone on stage clucking like a chicken? Yeah, it's an image that's full of mystery and spectacle. But today, we're going to pull back that curtain and look at its powerful, evidence-based counterpart, clinical hypnosis.
So that's the big question, right? Is this stuff just mind control for a good laugh, or is it a legitimate medical tool? Well, to answer that, we have to get way past the stage and step into the clinic.
So on one side, you've got stage hypnosis. Its goal is simple, entertainment. But on the other side, you have clinical hypnosis, or hypnotherapy. And that happens in a private clinical setting, and the goal is totally different. It's healthcare. But here's the most important difference, the real game changer, control. That popular myth that you lose control, the entire point of clinical hypnosis is the exact opposite. It's not about losing control, it's about helping you gain more of it.
But before we get into all the things it can do, let's talk about who is actually doing it. Because, understanding the practitioner is absolutely key to understanding the practice itself.
First off, this is not some new age trend that just popped up. The main professional group, the American Society of Clinical Hypnosis, was founded way back in 1957 by the legendary physician Milton H. Erickson. So from the very beginning, this practice has been rooted in medical science.
So who are these professionals? Well, to be a member of ASCH, you can't just, take a weekend course online. Nope, you have to be a licensed healthcare worker with at least a master's degree. A lot of them have doctorates. We're talking physicians, psychologists, dentists, and every single one of them is bound by a super strict code of ethics. We are a long, long way from a stage performer in a sparkly vest.
Okay, so we've established we have these highly trained pros, but what are they actually doing in the clinic? I mean, what is hypnosis really good for?
So here's the official definition. It's basically a state of super-focused attention and heightened suggestibility. The best way to think of it is like a mental spotlight. You focus your attention so intensely on one thing that your mind becomes way more open to new ideas and directions that can help you deal with a condition.
And the applications, they are seriously broad. According to the Mayo Clinic, it's used for everything from controlling chronic pain, think burns or cancer pain, and managing the side effects of chemotherapy, all the way to changing behaviors like smoking or overeating. It can also be incredibly effective for easing anxiety, fears, and phobias.
Now what about the downside? Are there risks? The Mayo Clinic is really clear that harmful reactions are extremely rare. When side effects do happen, it's usually mild stuff like dizziness or drowsiness. It's considered a very, very safe procedure, especially when it's done by someone who's trained and licensed.
So let's say you were interested. How would you find someone credible? Really, it just comes down to doing your homework. Get a recommendation from someone you trust, and then just ask a ton of questions. Do they have specialized training? Are they a licensed professional, like a psychologist or a doctor? This makes sure you're in safe professional hands.
Okay, now let's go a little deeper into the how. This is where it gets really fascinating. We're going to look at the work of the founder himself, Milton Erickson, because his approach really shows the true elegance of this whole thing.
Erickson's big idea was something called the utilization approach. Instead of trying to fight a patient's resistance or their personal beliefs, he would just accept them, and then he'd use them. This was a massive shift from that old authoritarian, look deep into my eyes style of hypnosis. Erickson worked with the patient, not on them. It's a really respectful and collaborative process.
Erickson's genius was often just in the way he used words. He was famous for using this technique called the double bind. A classic example he used with kids was this question. I mean, on the surface, it seems like a pretty simple choice, right? But look closer. The choice isn't if you're going to put on your pajamas, it's where you're going to do it. See, both options lead to the actual goal, getting ready for bed. This just slips right past any resistance by creating this little illusion of choice, gently guiding behavior without ever giving a direct command. It's so subtle, but it is incredibly powerful.
Okay, let's look at another wild example from Erickson's own case files. A patient, who he calls Lucy, is in a trance, and her arm is just floating in the air. It's a phenomenon called catalepsy. When Erickson asks her about it, she seems genuinely confused. She says, "I don't know what's happened to my hand and arm," and then she kind of realizes, oh, it's right there, isn't it?
So what is going on there? This demonstrates a fascinating state known as trance logic. In this hypnotic state, your mind can accept two totally contradictory ideas as true at the exact same time with zero conflict. For Lucy, her arm could be this disconnected thing over there, and at the same time be attached to her right here. It's inside this really unique mental space that real therapeutic change can happen.
So as we start to bring this all together, it's pretty clear we're talking about a very sophisticated psychological tool, and not, some form of magic.
If there is one thing, one single thing you take away from all this, let it be this. Clinical hypnosis is the polar opposite of losing control. It's a partnership with a therapist where you learn how to use your own power of focused attention, that mental spotlight we talked about, to gain more conscious control over things you thought were automatic, like pain, anxiety, or bad habits.
And that really leaves us with one last thought. We've seen that hypnosis, at its core, is all about harnessing the power of focused attention. And that's a natural ability that every single one of us has. So the only question left is, if you could harness that power, where in your own life could you direct your focus to create some real, meaningful change?